Today's subject is hypertension and aspirin. About a few years ago, we got big news about is it necessary to take aspirin for pre hypertension situation. And then, according to the article, that the effectiveness for to lower blood pressure is minimum or questionable, but long-term taking causing internal bleeding in the stomach. And then, many doctors are confused, but also many, patients are confused, and we don't know what to do. And then, some of them, even though the medical doctor who, prescribe aspirin, and then, they are in doubt. And some of them argue, some of them, we gotta listen, and about 50% each, different opinion, pro and con. Then why that kind of subject is mentioned and is research? This is something new. You probably never heard of before. The point I'm trying to make is aspirin had long history of, for prescription, almost more than 120 years. And according to the patent, on 1899, aspirin was patent for the medicine. So from 1899 until 2022, it is more than 120 years. One of the, longest history. And not many people heard that, because of aspirin overdose or, because of aspirin, somebody killed. We don't hear that kind of news, much either. And another thing, and the vitamin and mineral. Now, vitamin mineral is over 100 years. And I never heard of, so far in my opinion, that somebody died because of, taking a vitamin mineral, overdose or misuse, things like that. We don't have to worry about whether it's water soluble. We don't have to worry about it either. We just take it, multivitamin mineral, and then manufacturer already knew about this one, so it is pretty safe. And then the people who take vitamin mineral, without the seasoning, they believe, I have good health because of that. So the medicine or drug for long history means that it is safe and proven more than 100 years. Then why, when you take aspirin, that the effectiveness is not minimal. Then somebody who advised take aspirin, they are all stupid, liar, because it was proven at the time. It is low, about 2-3%, lowering, hypertension. That's why they prescribe. But now suddenly the effectiveness is less. I don't think that those kind of data is accurate. Then, also, causing internal bleeding. You know why? I think because this, this kind of report, they're kind of plan. The price of aspirin relatively is less, so someone try to sell expensive drug or medicine instead of aspirin. We can think, we can make any kind of assumption. Then why there is internal bleeding? There's two reasons, in my opinion. First one is long-term use, any kind of medicine for long-term use, causing, stomach ache, any kind of thing happen in the stomach because of long-term use. Then, second question is, okay, the doctor said, okay, you are pre-hypertension, so you have to take this aspirin in order to lower your high blood pressure. Now, what kind of guideline, medical doctor use? Now it's 120 to 140, that is a pre-hypertension number, but those number may be artificially higher number. It's not necessarily hypertension. So the patient does not need to take it, but because of medical doctor request, the patient take it. Because of artificial number must be, questionable. Okay? However, my opinion is, you do all the exercise I showed you before. Then you don't have to worry about all this kind of a gimmick. So do all the exercise I suggest. Okay? Thanks so much for your watching.